Imagine receiving a report stating that a loved one may have been misusing drugs based on inconclusive evidence. How would you feel? This is the heart of a significant ethical dilemma in the world of forensic pharmacology. Forensic analysts, those individuals behind the scenes, analyzing samples and uncovering truths, often grapple with a tough question. Should they report on pharmacological findings that might hint at drug misuse or abuse, even if the evidence isn't concrete? Or should they stick to the principle of beyond reasonable doubt, only reporting what can be definitively proven? Let's paint a picture. Suppose a forensic analyst stumbles upon findings that suggest but don't conclusively prove drug misuse. What's the right call? To report and potentially cause undue harm, or withhold and possibly miss an opportunity for intervention? This is the ethical dilemma that forensic pharmacologists often find themselves in. Now, consider the case of John Doe, a high school teacher accused of drug misuse based on inconclusive evidence. His reputation and livelihood were jeopardized when a forensic analyst reported traces of illicit substances in his system. However, these findings were not conclusive. The substances could have come from a range of legal medications, and there was no evidence of misuse. Yet, the report led to a scandal, and John lost his job before he could clear his name. This case poses a question. Should inconclusive findings be reported if they can cause such harm? Let's move on to a second scenario, featuring Jane Smith. Jane was involved in a horrific car accident. A forensic analyst found traces of opioids in her system, which were dismissed as they were below the threshold that suggested misuse. However, Jane had been struggling with addiction in silence. The overlooked evidence could have led to an intervention, perhaps even saving her life. The tragic outcome of Jane's case raises the opposite question. Should forensic analysts report even minor evidence of potential misuse? These two contrasting stories highlight the ethical dilemmas faced in forensic pharmacology. There's a delicate balance between protecting individuals from unfounded accusations and ensuring that potential dangers are not overlooked. The question of when to report findings is not just about ethics, but also about the profound impact these decisions can have on people's lives. These cases highlight the ethical tightrope that forensic pharmacologists walk on a daily basis. So, where does this leave us in the debate about the ethics of forensic pharmacological reporting? We've skimmed the ethical dilemma, the potential harm of reporting inconclusive findings, and the risks of overlooking conclusive evidence. We've seen how the scales can tip on both sides, reflecting the complexity of this issue. Ultimately, the ethical reporting of forensic pharmacological findings is a complex issue that requires careful consideration and judgment. But one thing is clear: the integrity of the forensic analyst and the well-being of the individuals involved must always be at the forefront.